मेरे मित्रों, विश्व हृदय दिवस 2023 की थीम है हर दिल के लिए दिल का उपयोग करें। इसका उद्देश्य है लोगों को हृदय रोगों और उनकी रोकथाम के बारे में शिक्षित करके प्रतिवर्ष हृदय रोगों से होने वाली मौतों की संख्या को कम करना। आधिकारिक वर्ल्ड हार्ट फेडरेशन अभियान के अनुसार इस विषय का मुख्य संदेश निम्नलिखित 3 स्तंभों से प्राप्त किया जा सकता है। पहला, मानवता के लिए हृदय का उपयोग करें। हृदय रोगों से जूझ रहे लोगों को बेहतर सहायता प्रदान करना, विशेष रूप से कम आय और मध्यम आय वाले देशों में। दूसरा, प्रकृति के लिए हृदय का उपयोग करें। दुनिया में समग्र वायु स्थिति में सुधार करने के लिए, क्योंकि वायु प्रदूषण हृदय रोगों से होने वाली 25% मौतों में योगदान देता है। और तीसरा, अपने लिए हृदय का उपयोग करें। बेहतर मानसिक स्वास्थ्य के लिए प्रयास करने के लिए, क्योंकि मनोवैज्ञानिक संकट लोगों को स्ट्रोक और अन्य हृदय रोगों के अधिक जोखिम में डालता है।
Friends, you have only one heart. So make sure that you give all your attention to its well-being. Friends, if you want to be responsible towards your family, be responsible towards your heart. Friends, a doctor cannot make you healthy. A nutrition expert won't make you slim. A teacher cannot make you smart. Gurus cannot make you calm. Your mentors won't make you rich. Your trainer won't make you fit. It is you, ultimately, who have to take responsibility. So, brace up. Take charge of your life. And save your heart and your life.
Friends, I am Dr. Satish Yograj, a medical specialist, a yoga therapist, a holistic healing consultant, and a life counselor.
Friends, I had decided to present this video on the topic of heart disease or cardiovascular disease and its holistic management on the occasion of World Heart Day, which is celebrated on 29th of September of every year. It is aimed at drawing people's attention to heart illnesses and a wide range of associated health issues in today's fast life. The day is commemorated to promote different preventive steps and changes in lifestyle to avoid any cardiovascular disease like heart attack, stroke, heart failure, and any other condition related to the same. The purpose of this video is to make more and more people aware of heart disease as its prevalence has crossed all imaginable levels. More than 500 million people around the world continue to be affected by cardiovascular diseases. Today, cardiovascular diseases are the leading cause of mortality and a major contributor to disability. Cardiovascular diseases accounted for 20.5 million deaths in 2021, which is close to a third of all deaths globally. This is more than that of people who die from HIV, malaria, and cancer. Cardiovascular disease death rates were higher in males than females. Cardiovascular diseases also account for 45% of deaths in the 40 to 69 year age group. Today, coronary artery disease or ischemic heart disease has become the leading cause of cardiovascular disease mortality across males and females. Every 20 seconds, a heart attack occurs, and a heart attack fatality occurs about every minute. About 1 in 20 adults aged 20 and older have coronary artery disease. In 2021, about 2 in 10 deaths from coronary artery disease happened in adults less than 65 years old. What is more alarming is that India has become slowly the world capital in the incidence of cardiovascular diseases and diabetes. Cardiovascular diseases have now become the leading cause of mortality in India. In India itself, the overall prevalence of coronary artery disease was 6.2% in men and 10.8% in women. Another alarming feature of coronary artery disease is that coronary artery disease occurs at a much earlier age in Indians. In fact, 35% of heart disease occurs in the working age groups of 35 to 64 years, which is almost 3 times that of the US, where only 12% of heart disease occurs before the age of 65 years. Between 1990 and 2015, the prevalence of the cardiovascular diseases rose by more than 50% in India. And in a population of more than a billion people, 10% of people without any risk factors may suddenly experience a heart attack. Last year, in 2021 itself, 70% of heart attack deaths occurred in the 30 to 60 age group. A total of 19,744 people aged 30 to 60 years died due to heart attacks in 2021. Friends, what is wrong with young Indians' hearts? Why we are having this grim state of affairs today? Why are we dying so early? Who is to blame for this? This has been worrying health officials and doctors in India today. Since cardiovascular disease strikes Indians nearly a decade earlier than the other populations, a large number of heart attacks happen to people between 30 and 69 years old, and nearly 30% of heart attacks come suddenly without a warning. This can be partly attributed to our unhealthy lifestyle. Additionally, preventive checkups are not a regular feature because people in India are less health conscious and less aware about heart disease, and they usually are more reluctant to spend reasonably out of their pocket for their health issues. Friends, I will tell you now some fascinating facts about our heart. Human heart is of the size of a clenched fist. A man's heart weighs on an average around 10 ounces and a woman's heart weighs around 8 ounces. It beats approximately 1 lakh times per day and about 35 million times per year. Our heart pumps about 5.7 liters of blood throughout the body in one pumping and about 2000 gallons of blood per day. A newborn's heart beats around 70 to 190 beats per minute. The average adult should have a resting heart rate between 60 and 100 beats per minute. If your resting heart rate is higher or increases over several years, it could be a sign of current or impending heart problems. Athletes who regularly train will have a very slow resting heart rate around 40 to 60 beats per minute. Women also have faster heart rates on average than men because their hearts are smaller in size and need to beat more to pump the same amount of blood. Your heart is located in the middle of your chest. It is found behind your breastbone, but it is tilted to the left, which makes it easier to feel on that side of your chest. Heart attacks happen most often on Monday mornings. Stress hormones are higher in the mornings than at any other point during the day, and Mondays in particular seem to cause people more stress than other days of the week. There are 60,000 miles of blood vessels in your body. If one of the vessels is damaged, it makes your heart work harder to pump your blood. The heart, which itself is a muscle, works twice as hard as the leg muscles of a sprinter. It takes a lot of force to move your blood around your body, and that is why a strong, healthy heart is so important. Friends, let's now talk about heart disease. Cardiovascular disease, also known as heart disease in common parlance, comprises of four entities: coronary artery disease or coronary heart disease, cerebrovascular disease, peripheral arterial disease, and aortic atherosclerosis. Coronary artery disease results from decrease in myocardial perfusion due to blockages within the lumen of coronary arteries. This causes angina or chest pain due to ischemia. However, if there is a sudden and complete blockage of coronary arteries due to a clot or a plaque, this can also result in myocardial infarction, also called as heart attack and or heart failure. Coronary artery disease accounts for 1/3 to 1/2 of all cases of cardiovascular disease. Friends, we shall now discuss the heart disease, its risk factors, causes, its prevention, and treatment options in detail. Please ensure that you see this video from beginning to end so that you don't miss out the important aspects of it, as every second of this video is very closely related to the next part in the following. So what is this coronary artery disease? Coronary artery disease is the most common type of heart disease and is the number one cause of death in India and all over the world. Coronary artery disease occurs due to blockages in blood vessels that supply blood and oxygen to the heart. These blockages develop over a very long period of time due to our unhealthy lifestyle. The most unfortunate aspect of heart disease is that the disease-related changes in the blood vessels usually begin to occur much earlier than the symptoms. This is the best time to take action to prevent development of significant and critical blockages later and so the advanced stages of this disease. Friends, let me explain now what are the symptoms of this heart disease. Once the blockages in the blood vessels develop, the most common symptom is angina, which is felt as pain, discomfort, or pressure in the chest, especially during physical activity. Although angina can occur at rest, in advanced stages, patients usually begin to notice chest pain during activity, which goes away when the activity is stopped. This symptom of angina or chest pain occurs because blockages in the blood vessels of the heart don't allow enough oxygen-rich blood to reach the heart muscle. Coronary artery disease is commonly diagnosed by doing a stress test or a stress echo. There is another form of presentation of heart disease besides angina, which is heart attack or myocardial infarction. Heart attack is the most feared consequence of coronary artery disease because in some people, the first symptom may be a sudden death. A heart attack or myocardial infarction occurs due to sudden and complete blockage in the blood vessels supplying the heart. Heart attack is dangerous because many times it does not give enough warning and time to reach to a hospital. The first hour of a heart attack is very critical. It is a critical time because the heart muscle starts to die within 80 to 90 minutes after it stops getting blood, and within 6 hours, almost all the affected parts of the heart could be irreversibly damaged. The first hour after a heart attack is also known as the golden hour. Taking appropriate action within this first hour can save a patient's life. In simple words, in case of a heart attack, the survival of a person will depend on what action he or she and his doctor takes during the first hour. More than half the deaths brought on by heart attacks happen because people are not aware of signs and symptoms that need to be taken note of during this golden hour. Only a small proportion of patients with cardiac and stroke emergencies reach health facilities early, according to a study conducted at AIIMS, Delhi. However, a much encouraging fact is more than 90% of people today survive a heart attack. People who survive a heart attack, in them, it has been possible primarily due to their recognizing the symptoms earlier and getting prompt treatment. A man's risk for heart attack begins to increase at 45, and for women it starts at 55. 1 out of every 10 people who have heart attacks, however, die within an year, usually within the first 3 or 4 months. Typically, these are the people who continue to have chest pain, abnormal heart rhythms, or heart failure. So, what are symptoms of an heart attack? Heart attack is an emergency that requires immediate medical attention. Therefore, it is important to promptly recognize the warning signs. Patients of heart attack usually experience sudden, severe, crushing chest pain that can travel to the left arm or back. It is usually not relieved by rest or medicines and can be accompanied by sweating and difficulty breathing. Less known warning signs for heart attack are severe pain in the jaw, back or stomach, sweating, nausea, and lightheadedness. Women are more than twice as likely to die after a heart attack than men, according to research presented on 22nd of May 2023 at Heart Failure 2023, a scientific congress of the European Society of Cardiology. 26% of women will die within a year of a heart attack compared with 19% of men. By 5 years after a heart attack, almost 50% of women die, develop heart failure, or have a stroke compared with 36% of men. It is because women usually ignore, take it casually, or misinterpret their heart attack signs like chest pain or discomfort, upper body pain, or discomfort in the arms, neck, or upper stomach, lightheadedness, or cold sweats. Women are somewhat more likely than men to experience some of the other common atypical symptoms, particularly shortness of breath, nausea or vomiting, back or jaw pain. A heart attack is diagnosed using ECG and certain blood tests like the troponin T test, which is a card test and does not take much time, and the CPK-MB test. Friends, there is another very important form of heart disease which is called heart failure. Heart failure is a serious, chronic long-term condition. In heart failure, the heart is not able to properly pump blood to the rest of the body. The most common causes of heart failure are coronary artery disease, high blood pressure, a previous heart attack, and diabetes. The most common symptoms of heart failure are shortness of breath, especially while walking or lying down, swelling of feet and ankles, fatigue, persistent cough, and decreased ability to exercise. Heart failure is diagnosed based on a measurement called ejection fraction that is obtained during an echocardiogram and a blood test called B-type natriuretic peptide. Friends, now let us see what increases your risk for heart disease. Risk factors for cardiovascular disease are particular habits, behaviors, circumstances, or conditions that increases a person's risk of developing cardiovascular disease. Cardiovascular disease risk factors are either modifiable or non-modifiable. Modifiable cardiovascular disease risk factors are those that can be reduced or controlled with your positively altered behavior. By making certain lifestyle changes, people are able to lower their chances of developing cardiovascular disease. Examples include stopping smoking, healthy diet, and exercise. Let's now find out what are important modifiable risk factors. High blood pressure is the most common risk factor for heart disease. Research shows that 3 out of every 10 adults in India have high blood pressure. Only one of those 3 is aware that he or she has a high blood pressure, and further, only a small proportion is receiving treatment for it. Although high blood pressure is believed to be a disease of older people, research has found that it is now commonly seen in young individuals as well, with an estimated prevalence of 1 out of 10 in people between the ages of 18 to 25 years in India. The best way to reduce risk of heart disease is to control the blood pressure so that it is consistently at or below the target blood pressure of 120 to 125 over less than 80 mm of mercury. Thus, a proactive and holistic approach, which includes a healthy diet, regular exercise, optimized medications, and wellness or stress management, is the best way to reach your blood pressure goals and reduce risk. Friends, diabetes is another common risk factor for heart disease in today's time. About 10 to 15% of people suffer from diabetes. This means that there are 20 crore people in India living with diabetes. Diabetes is considered the worst risk factor for heart disease. Patients with diabetes have 2 to 3 times greater risk of getting heart disease when followed over time. Adults with diabetes are 2 to 4 times more likely to die from heart disease than adults without diabetes. About 70% of people aged 65 years or older with diabetes die from some form of heart disease. Most people with diabetes have at least one other risk factor for heart disease. Out of every 5 adults with diabetes, approximately 4 have high blood pressure, 4 have high cholesterol, and 3 have obesity. Diabetes affects not just the heart but also damages small and large blood vessels. Patients with diabetes can have also strokes, legs pain, nerve damage, eye damage, and kidney damage. Another risk factor for heart disease is high cholesterol levels. There are different types of lipids or fats, commonly referred to as cholesterol, in our body. The 2 most important ones in relation to heart disease are LDL and HDL. Abnormal cholesterol in the form of high levels of LDL or low levels of HDL is seen in 20 to 35% of people. Worldwide, approximately 50% of heart disease is due to high LDL cholesterol. Smoking is also a very important risk factor for heart disease. Smoking increases your risk of heart disease and heart attacks. Cigarette smokers are 2 to 4 times more likely to develop heart disease compared to non-smokers. A person's risk of heart attack continues to increase with the number of cigarettes smoked and the duration of smoking. The longer a person smokes, the higher is his or her risk of a heart attack. In addition to heart disease, smoking is an important risk factor for diseases of blood vessels, multiple cancers, and chronic lung diseases. Another very important risk factor and less understood by people today is stress. Friends, we all encounter many different types of stress at some or the other times in our lives. Some last longer than others, while some are more positive than others. Yes, we just said that there is such a thing called as positive stress. It is called eustress and we should learn to love it. But we cannot forget about negative stress, which is called distress. Eustress is a type of good stress that makes us more motivated, focused, and energized. Eustress supports the growth mindset. We need to learn new skills and face our challenges. Distress is what most discussions about stress revolve around. This kind of stress is what we should avoid and manage, as negative stress makes us worry, feel anxious, and doubt ourselves. This distress or emotional stress causes a negative chain reaction in your body. If you are angry, anxious, tense, frustrated, frightened, or depressed, your body's natural response is to release stress hormones. These hormones include cortisol and adrenaline. They cause your heart to beat more rapidly and your blood vessels to narrow to help push blood to the important areas of body. These hormones also increase your blood pressure and blood sugar levels. After your stress subsides, your blood pressure and heart rate should return to normal. But if you are continually stressed in your life, your stress hormones in blood will remain high and your body will not have a chance to recover. This eventually leads to chronic damage to your arterial walls. What is more important to understand here is that if you already have coronary artery disease, myocardial ischemia can be further aggravated by this emotional stress. In fact, any strong emotion such as anger may also cause severe and fatal irregular heart rhythms in this situation. Expressions like died from fright and worried to death are not just hyperbole, they are real life physiological possibilities. Furthermore, when patients with newly diagnosed heart disease become depressed, that depression further increases the risk that a harmful heart-related event will occur within that year. Many of us know that volatile emotions like anger and hostility are bad for heart health. But studies have shown that some of the quieter emotions can be just as toxic and damaging for the heart's health. Study after study has shown that people who feel lonely, depressed, and isolated are many times more likely to get sick and die prematurely, not only of heart disease but virtually from all causes, than those who have a sense of connection, love, and support in their community. Friends, another important risk factor for heart disease is one's personality type. Someone who is impatient, aggressive, and very competitive, often called a type A personality, has a higher risk of heart disease. The deleterious effects of type A behavior on cardiovascular morbidity and mortality are mediated by the higher physiological reactivity to external demands, especially when there are elements of competition. people with type A personality have behavioral traits such as chronic stress and an increased risk of burnout and anxiety, strained social relationships and properly connecting with others on a deeper level, difficulty delegating tasks, excessive self-criticism and feeling of inadequacy, and difficulty with work-life balance. Friends, there is another personality type which is associated with heart disease, and that is type D personality. Having a type D personality has also been linked to an increased risk of cardiovascular disease. Type D personalities are characterized by a high level of emotional distress, reluctance or inability to open up to others. They are inhibited socially. They keep people at a distance. They have a pessimistic view on life, and they are usually trapped in their negative emotion. A 2004 study revealed that type D personalities were 4 times more likely than average to die or have a heart attack within 9 months of stent placement during angioplasty. Since type Ds do not get help or share their anxieties, they are unable to relieve that stress. Another very important risk factor in today's modern and fast time is sedentary lifestyle and lack of exercise. Studies have reported 2 times the risk of heart disease in people with very little or no physical activity. In fact, even low intensity and short duration of regular exercise is beneficial compared to no exercise. Research has shown that regular exercise reduces deaths not only due to heart disease but also due to all causes by 45% and 30% respectively. Regular exercise also reduces other risk factors and helps improve diabetes, high cholesterol, stress and high blood pressure. Friends, another important risk factor for heart disease is our unhealthy diet. Today, it has become the foremost risk factor for death and disease in India. In all celebrations in India, food rich in saturated fats, trans fats and sugar is eaten. Ghee, butter and coconut oil, which are used in cooking throughout India, have been related to blockages in arteries. Reheating oil, which is commonly done in India for deep frying, produces trans fats which are very harmful for arteries and the heart. So friends, today decide to make a healthy change in your lifestyle. Another significant risk factor for heart disease is blockages due to atherosclerosis in other parts of the body. Similar to the blockages in the blood vessels supplying your heart that occur in heart disease, dangerous blockages can occur in the blood vessels of the brain, neck, abdomen and legs due to unhealthy lifestyles. These are dangerous because they can not only result in stroke and decrease blood and oxygen to muscle and vital organs, but also indicate increased risk factors for heart disease. Thus, they are considered heart disease equivalents. Friends, then there are non-modifiable risk factors which are based on genetic inheritance on which we cannot have much control. People with a family history of heart disease are at an increased risk of heart disease. Additionally, some risk factors like certain types of abnormal lipids, high blood pressure and diabetes can occur due to genetic conditions or occur in families. In general, heart disease is more common in men. Women under the age of 50 will virtually never have a heart attack. However, once the women reach menopause, the rate equalizes because the protective effects of the hormones are lost, and eventually more women die of heart disease than men. Heart disease is more common in elderly people because the damage caused by the various risk factors continues to add up over the years. Now I will discuss how to diagnose the heart disease. When we decide to diagnose and assess the severity of heart disease, we need to perform tests specific to heart disease and also investigate all the risk factors of heart disease. Blood pressure measurement is very important in the diagnosis and management of heart disease and is routinely measured in a doctor's clinic. Measuring blood pressure at regular intervals is necessary to make sure that treatment and lifestyle modifications are being effective and in order to achieve target blood pressure goals. There is one entity called as white coat hypertension. In some cases, blood pressure measured in the clinic can be high, even though the person does not have high blood pressure disease. This happens because of increased anxiety and fear that some people feel when they go to a doctor. This is also an important risk factor for future heart disease. In order to get an accurate BP measurement in these people, self-measurement of blood pressure at home or ambulatory blood pressure monitoring is recommended. Friends, let me now explain what blood tests are done in heart disease. High cholesterol and diabetes are common risk factors for heart disease, and their management is an integral part of complete cardiac care. Following blood tests are done in an individual with heart disease: a complete blood count, lipid profile, fasting and 2-hour blood sugar, HbA1c, liver function tests, and renal function tests. Doing an ECG in an individual with heart disease is very important for diagnosis as well as follow-up during the course of treatment. In a patient of heart disease, there is a change in heart's electrical activity due to damage to electrical channels. This happens due to either ischemia or due to enlargement or damage to heart muscle. An ECG measures this electrical activity. Additionally, an ECG can also reveal various other heart disorders like abnormalities of heart rhythm, presence of fluid around the heart, abnormal thickening of the heart walls, and permanent heart damage from blockages. Another very important and common diagnostic test done for evaluation of heart disease is the stress test. In most heart patients, although the blockages reduce blood supply, the heart is able to function at rest. However, during physical activity and exercise, the heart requires more blood but cannot get it due to blockages. As a result of the high demand but low supply of blood, the electrical activity of the heart is affected. This change in electrical activity during physical activity is measured during a stress test. During a stress test, an ECG is recorded in the same manner using electrodes while the patient is walking or cycling and at rest. Echocardiogram is an important diagnostic test done in individuals with heart disease to evaluate the size, appearance, and function of the heart walls and structure of large blood vessels that enter and leave the heart. It is used to evaluate permanent heart damage from blockages, decreased pumping activity of the heart in heart failure, abnormal thickening of heart walls, blood flow through the heart valves, narrowing or widening of heart valves, infection of heart valves, collection of fluid around the heart, presence of blood clots in the heart, abnormal connections between heart chambers. Then another test is stress echo. A stress echo is similar to the ECG stress test in that it reveals what happens to the heart during physical activity or exercise. Friends, another very important diagnostic test in heart disease is Holter monitoring. In some cases, heart abnormalities may not be seen on the ECG taken in the doctor's clinic. This happens because the abnormal rhythm or abnormal function of the heart can be transient and it appears and disappears at random times throughout the day. A Holter monitor records the ECG throughout the day so that a doctor can capture, record and diagnose these transient abnormalities like abnormal rhythms. Friends, the most important test in the diagnosis of heart disease is cardiac catheterization and coronary angiography. The degree of narrowing of the blood vessels of the heart due to blockages is definitely visualized during a coronary angiography or cardiac catheterization done by an intervention cardiologist in a cardiac cath lab. If a significant narrowing due to blockages is seen, the cardiologist can open up the blockages during the same procedure. This is called angioplasty. Alternatively, the cardiologist may recommend bypass surgery based on the degree, type, and the blood vessel with blockages. Friends, now I will tell you how can we prevent heart disease from developing. The best successful strategy in this direction is to first motivate ourselves for a healthy and a long life and begin prevention early in life. People of all ages can benefit from heart disease prevention. However, being proactive and starting early puts you in a much better position for the rest of your life. According to the American Heart Association, heart health screenings should begin in your 20s. Foremost in this direction is adopting a healthy lifestyle. You start making healthy diet choices in your daily life. Eat plenty of fruits, vegetables, whole grains, legumes, nuts and seeds. Choose lean meat when you do eat meat. Limit fried foods and sugary drinks and avoid food rich in saturated fats, trans fats, sugar and sodium. Be physically active and do some kind of exercise regularly. The goal per week should be at least 2.5 hours or 150 minutes per week of moderate intensity physical activity like brisk walking, or an hour and 15 minutes or 75 minutes per week of vigorous physical activity like jogging or running. Walking for an average of 30 minutes or more a day can lower the risk of heart disease, stroke by 35% and type 2 diabetes by 40%. It is not just your heart and muscles that benefit from walking. Regular physical activity can help reduce your risk of heart disease and stroke. A combination of cardiovascular aerobic activity like walking or running and muscle strengthening exercises are ideal. If you don't currently exercise, for your safety, start with a short duration of low intensity physical activity like walking and gradually build it up under the supervision of your doctor. Then decide to stop smoking. The quickest way to reduce your risk of heart disease is to stop smoking. Within 1 year after stopping smoking, the risk of heart disease decreases by half or 50%, and within 2 years, the risk is reduced by more than 90%. Then decide to manage stress in your life. This can be done by making time for family and friends, getting enough sleep, keeping an optimistic frame of mind, making a daily habit of stress-relieving activities like yoga, meditation, prayer, and sound healing techniques such as mantra chanting and listening to relaxing music, then finding a stimulating pastime that can be enjoyable while also distracting you from unpleasant thoughts or worries is a good idea. Then maintain healthy weight. Maintaining your weight within the recommended healthy weight range through regular physical activity and a healthy diet can reduce your risk for developing heart disease risk factors like high blood pressure, diabetes, and high cholesterol. Get yourself checked regularly. Depending on your age and initial level of risk, regular checkups are recommended from anywhere between once every 3 months to once every 1 to 2 years. This can include blood pressure checks, blood sugar levels, cholesterol levels, and body mass index. As people get older, the risk increases and the risk factors like high blood pressure, diabetes, and high cholesterol can develop insidiously. They can begin causing damage much before any symptoms develop, and regular checkups can identify these factors in the early stages so that they can be managed before significant damage occurs. Manage your risk factors if there are any. Identifying and managing risk factors early can detect the slow progression of disease in the initial stages and prevent further damage. In this direction, the goal should be to achieve consistent normal blood pressure, normal blood sugar, and cholesterol control to as low levels as possible and as early as possible. Friends, let us now see what are treatment options in heart disease. As a holistic healing consultant, when it comes to treating a heart disease in my holistic healing center, I recommend using a combination of treatment options in order to control and treat heart disease from all possible ways. This I consider as the most effective approach because heart disease and its risk factors are best controlled by a combination of the different treatments available. In today's time of medical revolution, medications to control cholesterol and blood pressure, medicines to improve blood circulation to the heart and improve its functioning, and surgical approaches like cardiac stents and bypass surgery are the mainstays of treatment and lifesavers for many. There is no second thought on this. However, this approach of modern medicine has not been shown to reverse the process of heart disease and significantly improve the morbidity and mortality of heart patients when it comes to living a long, healthy and a satisfying life after having suffered from the heart disease. Friends, since healing literally means to make whole, logically speaking, the body cannot be fully healed if only one aspect of its existence is treated. Our body is not just a physical entity, it is a comprehensive mind, body, soul complex. Unfortunately, modern cardiac treatment programs focus solely on medication regimes and very little emphasis is laid on diet and exercise, and further, without adequately addressing the anxiety, depression, fear, and loneliness that can so commonly follow a serious cardiac event like heart attack. So, an integrative approach to healing that fully addresses the mind, body, spirit components of health and wellness has been, according to modern scientific research, proven to have a powerful ability to heal hearts physically and metaphorically. For this, an active engagement between the patient and the doctor is important, which enhances the effectiveness of the healing process. Research by US cardiologist Dr. Dean Ornish has convincingly shown that an alternative comprehensive program of diet, exercise, and stress management can significantly reverse the damage to the heart to a great extent. As a holistic healing consultant, I recommend that the individuals who suffer from heart disease should start taking medications advised by their doctor sincerely and visit their doctor regularly for follow-up advice. And at the same time, also seriously begin taking alternative steps in following the comprehensive lifestyle modification program I usually recommend it to my patients of heart disease. This integrative approach to healing will reduce down the extent of morbidity in patients of heart disease, and if sincerely followed over the lifetime, it will also significantly reverse various blockages and damages in the heart and also reduce the mortality to a greater extent. This comprehensive lifestyle modification program includes 4 key lifestyle areas: diet, exercise, stress management, social and spiritual aspects of our being. First and foremost way is to modify the existing diet you usually take today. A typical Western diet we eat today comprises of meat, dairy products, eggs, processed grains, fast food or fried foods, high added sugar, sweets, desserts, high salt, calorie dense foods, and low fiber foods. I strongly recommend against this diet. Instead, I recommend following an Ornish diet. The Ornish diet, when used in a holistic treatment program, has been shown to lower blood cholesterol levels and reverse atherosclerosis or obstruction of the arteries, making it a dietary therapy for heart disease, strokes, high blood pressure, and high cholesterol. The Ornish diet has also been shown to be an effective weight loss program and is also recommended as a preventive measure for heart disease, strokes, diabetes, and other conditions related to high fat consumption. The first principle of the Ornish diet is to eliminate cholesterol. So all foods containing cholesterol and saturated fats are removed from the diet. Saturated fats are found in meat, dairy products, oils, nuts, seeds, and avocados. The diet allows the use of egg whites. Another feature of the Ornish diet is the ratios assigned to fat, protein, and carbohydrates respectively. The typical Western diet which we eat today is 45% fat, 25% protein, and 30% carbohydrates, with nearly 500 mg of cholesterol per day. Whereas the preventive Ornish diet is 10% fat, 20% protein, and 70% carbohydrates. The Ornish diet consists mainly of complex carbohydrates, commonly called starches. Complex carbohydrates are present in fruits, vegetables, grains, and beans. Since carbohydrates include sugar, honey, and alcohol, which tend to be empty calories because they contain lots of calories but little fiber or nutrients. The Ornish diet restricts but does not eliminate simple carbohydrates. The Ornish diet also emphasizes high fiber foods, which includes most complex carbohydrates. High fiber diets have also been shown to reduce cholesterol and have other beneficial effects. Friends, second pillar of this comprehensive lifestyle modification program is to exercise regularly. Cardiovascular benefits of exercise include strengthening your heart and cardiovascular system, improving your circulation and helping your body use oxygen better, improving your heart failure symptoms, lowering blood pressure, improving cholesterol, and lowering your stress levels. But once an individual has suffered from heart disease, his program of exercise will be different and calculated. As such, just because you have had a heart attack, a weak heart, or other heart disease does not mean that you have to sit around and do nothing. In fact, with regular exercise, you may hasten your recovery, improve your heart function, and even get off of some of the medications you are on. Friends, it is never too late to increase your physical activity or start an exercise program. Get an OK and some guidelines from your personal doctor before you start. Just step out and start to exercise. Here, as a holistic healing consultant, I would recommend following guidelines to start with exercise schedule. For many people, it is easy to start with walking. Here is an example of a walking program. You walk in the hallway, walk the length of your driveway, walk in the mall, walk a block, and walk for only 10 minutes to begin with. Remember, you are starting slow and easy. You may need to plan rest areas or places to stop and sit along the way. For this, you can start at home initially. In about 5 weeks' time, starting slowly, you can slowly build up your exercise schedule. Make a routine that fits your needs. As you progress, if you are under the supervision of a cardiac rehabilitation team, they can help you increase your activity slowly, steadily, and safely, incorporating new activities you enjoy. The FIT principle is a guideline to help you set up a workout routine that fits your goals and fitness level while helping you get the most out of your exercise program. It helps you track and measure your progress. FIT stands for first frequency, that is how often to exercise. The goal is to exercise most days of the week. Then intensity means how hard to exercise. The rate of perceived exertion is how hard you feel your body is working. It is based on the way your body feels during exercise, including increased heart rate, breathing rate, sweating, and muscle tiredness. Then time means how long to exercise. Exercising 150 minutes each week should be the final goal. Then type. What type of exercise? Aerobic or endurance exercise involves continuous movement of your large muscles like your legs. It increases your breathing and heart rate, which improves your heart, lungs, and circulatory system. Then resistance exercise involves the development of muscle strength and endurance. Examples are lifting weights, using resistance bands, and pushing or pulling your own body weight. Then stretching or flexibility exercise keeps your muscles relaxed and your joints pliable. Friends, once you are recovering from heart disease and if you have begun the exercise schedule, the best way to know if you are doing an exercise properly is to listen to your body. The following information can help you decide if the way you feel is normal or not while doing exercise. During exercise, it is normal to feel comfortable, aware of your own breathing, but not out of breath, slightly tired, dry or slightly sweaty, and relaxed. Friends, here I am suggesting general workout tips and caveats for people with heart failure and other forms of heart disease. Avoid too much isometric exercises such as push-ups and sit-ups. Isometric exercises involve straining muscles against other muscles or an immovable object. Don't exercise outdoors when it is too cold, hot or humid without checking with your doctor first. High humidity may cause you to tire more quickly. Extreme temperatures can interfere with circulation, make breathing difficult, and cause chest pain. Better choices are indoor activities such as mall walking or a treadmill. Make sure you stay hydrated within reason. It is important to drink water even before you feel thirsty, especially on hot days. But be careful not to drink too much water. Check out with your doctor first. If your exercise program has been interrupted for more than a few days, for example due to illness, vacation or a bad weather, make sure you ease back into the routine as early as possible. In this case, start with a reduced level of activity and gradually increase until you are back where you started. Friends, there are some warnings during exercise if you are a heart patient. There are some precautions you must keep in mind when following an exercise program. Stop the exercise if you become overly fatigued or short of breath. Discuss the symptoms with your doctor or schedule an appointment for evaluation. Do not exercise if you are not feeling well or were very recently ill. You should wait for a few days after all symptoms disappear before restarting the exercise program. If uncertain, check with your doctor first. If you have persistent shortness of breath, rest and call your doctor. The doctor may make changes in your medications, diet or fluid restrictions. Stop the activity if you develop a rapid or irregular heartbeat or have heart palpitations. Check your pulse after you have rested for 15 minutes. If it is still above 120 beats per minute at rest, call your doctor. If you experience pain, don't ignore it. If you have chest pain or pain anywhere else in the body, do not allow the activity to continue. Performing an activity while in pain may cause further stress on your heart or damage to your joints. Friends, stop exercising and rest if you have any of the following symptoms like chest pain, weakness, dizziness or lightheadedness, pressure or pain in your chest, neck, arm, jaw or shoulder, or any other symptom that causes concern. Never exercise to the point of chest pain or angina. If you develop chest pain during exercise, call your doctor right away. The third pillar of the comprehensive lifestyle modification program I recommend is to manage your stress. Stress management is an integral part of a holistic approach to health and heart disease. Stress management involves various strategies to cope with and reduce stress. Ensure that you spare some time to meditate daily. There is no right or wrong way to meditate. The key is finding a practice that works for you. Try to set aside time each day to establish a routine and get comfortable with meditating. even just a few minutes a day can make a big impact. Studies have shown that establishing a daily meditation practice decreases activity in the two regions of our brain called amygdala and the default mode network. Amygdala regulates concentration, memory, and emotions such as fear, anger, and sadness, while default mode network is to blame for daydreaming and wandering thoughts. Decreased activity in these areas with meditation calms your minds, thoughts, and emotions. This reduces stress and you may experience a sounder sleep, less anxiety, and a more positive outlook on life. This reduction of stress activates our parasympathetic nervous system or the recovery or rejuvenating system and lowers the levels of stress hormones such as cortisol, adrenaline, and norepinephrine, which are linked with heart disease. So, integrating the practice of meditation into a daily routine has been linked to lower heart rate and blood pressure, which lowers your risk of heart disease and helps in your recovery if you are suffering from heart disease. There are many types of meditation that can result in healthy physiological benefits, such as guided meditation, which uses mental images to help you relax, transcendental meditation, which uses a repeated sound or a phrase to help you empty your mind, and mindfulness meditation, which focuses on the present moment and helps you to accept it without judgment. In various studies, meditation has been consistently shown to lower your heart rate, blood pressure, breathing rate, oxygen consumption, adrenaline levels, and levels of cortisol, a hormone released in response to stress. All this leads to a prevention of heart disease as well as undoing the blockages and damages in our cardiovascular system. Friends, another important activity which you can inculcate into your daily routine is yoga. Yoga has today proved to be of great benefit in preventing and managing heart diseases. Yoga is a mind-body activity that involves moving through a series of body poses and breathing exercises that improve strength, flexibility, balance, and gives relaxation. One of yoga's clearest benefits to the heart is its ability to relax the body and mind. Friends, worry and depression commonly follow a cardiac event such as heart attack, bypass surgery, or a diagnosis of heart disease. As part of an overall treatment plan, yoga helps you to manage this stress. Beyond offloading stress, practicing yoga helps in lowering blood pressure, blood cholesterol, blood glucose levels, as well as your heart rate, making it a very useful lifestyle intervention. One study had shown that waist circumference, a marker for heart disease, improved in middle-aged adults with metabolic syndrome who practiced yoga for 3 months. Another study has shown that slow-paced yoga twice a week reduced the frequency of atrial fibrillation episodes in patients with that condition. In another report, patients with heart failure who went through an 8-week yoga program showed improvement in exercise capacity and quality of life. They also had low blood levels of markers for inflammation, which contributes to heart disease. Yoga is one of the most effective ways to naturally reduce your cholesterol levels. Yogasanas or yoga postures, which can be done in patients of heart disease are Vrikshasana or a tree pose, Uthita Hastpadasana or extended hands and feet pose, Veerbhadrasana or a warrior pose, Trikonasana or triangle pose, Utkatasana or chair pose, Adhomukha Swan Asana or downward facing dog pose, Marjariasana or cat pose, Bhujangasana or cobra pose, Ardh Matsyendra Asana or sitting half spinal twist, and finally Shavasana or a corpse pose. Friends, some other lifestyle factors which are important in the management of heart disease are: make proper time management in life, organize your tasks and prioritize to reduce overwhelming feelings. Spend some time in hobbies, engage yourself in activities you enjoy to unwind and relax. Try to limit technology in your daily life, take breaks from screens to reduce digital stress. Always try to set realistic goals in life. Avoid overloading yourself with unrealistic expectations. Be good to your heart, body and mind. Do what makes you happy. Make sure that you are kind to yourself, your body and your heart by keeping stress levels to a minimum, practicing mindful conscious living and considering if your emotions could be affecting your heart health. Friends, self-care equals self-love, so stay heart-centered and focus on positive energy in your daily life. Be careful what you think because your thoughts run your life. Every cell in your body is constantly listening to your thoughts and your heart. Health comes from peace of mind, peace in your heart, and peace in your soul. This will help you greatly in remaining stress-free and will further help you in your recovery. Friends, a fourth part of the comprehensive lifestyle modification program which I recommend in my treatment plans to heart patients is to have adequate social support. Maintain strong social connections and seek emotional support from friends and family. Surround yourself with supportive friends and family and be mindful of negative thoughts and behaviors. A robust support network greatly helps in reducing stress and improve mental health. Friends, in the social support system, another important factor which I usually highlight during my treatment plans is love. Love, particularly love that develops into a committed relationship, can have a positive impact on overall health. Studies indicate that love impacts our mental, physical and emotional well-being in unexpected ways, and benefits include decreased risk of heart disease, lower blood pressure, improved immune health, faster recovery from illness and longer lifespan. Love is a stress buster. It is no surprise that having the support of someone who loves you makes it easier to cope with stressful situations. Being in the presence of your loved ones or even just thinking of them boosts your oxytocin hormone, which has been shown to lower adrenaline and cortisol levels. I shall now discuss medications recommended in treating the heart disease and the surgical procedures which are done in clearing blockages in the heart. Depending on the age and risk factor of the patient, a number of different medicines may be recommended. These include cholesterol lowering medicines like statins, which are very important in heart disease treatment and for primary prevention in patients at high risk. Then comes blood pressure lowering medicines. Broadly, BP lowering medicines include the following groups: diuretics, beta blockers, calcium channel blockers, and ACE inhibitors. There are many different reasons doctors give specific drugs to people with heart disease. They are given to relieve chest pain by reducing the heart's workload and widening arteries of the heart, for example, nitrates. They are given to prevent angina and acute coronary symptoms from occurring, like beta blockers, calcium channel blockers, and sometimes ranolazine. Then they are given to prevent and reverse coronary artery narrowing from atherosclerosis, for example, angiotensin converting enzyme inhibitors, angiotensin II receptor blockers, statins, and antiplatelet drugs. Then they are given to open a blocked artery, for example, clot dissolving drugs and anticoagulants. Then there are medicines to prevent blood clots from developing during the period of the treatment. Usually, low dose aspirin is given, especially after an angioplasty or stent procedure. Friends, then there are surgical procedures for heart disease, like angioplasty. Angioplasty has today become a very important procedure to open up the blockages and maintain the blood flow to heart's structure. Angioplasty is a minimally invasive procedure. There is one major procedure done in heart patients, and that is bypass surgery or coronary artery bypass graft surgery. A coronary artery bypass graft surgery is the most invasive treatment option that is required in certain people. The surgery involves taking a blood vessel from another part of the body to create a detour around the blockage so that the heart can receive adequate blood through an alternative route.